Sleep is vital to our health. If we don't sleep well, it can affect our daily life and well-being.
Sleep apnea is a serious medical condition that causes our airway to close repeatedly during sleep, preventing us from getting the healthy sleep and oxygen our body needs. Millions of men, women, and children snore or have sleep-disordered breathing, or sleep apnea. Unfortunately, many of them don't get diagnosed or treated. Choices in treatment have improved over the years, and they may be simpler than you think. Active member of the American Academy of Dental Sleep Medicine, Dr. Roberta Garceau and her caring team know how important quality sleep is for not only their patients, but their families as well. She offers non-invasive treatment options for snoring and sleep apnea, and compassionate care to help you get the sleep you need.
So sleep-disordered breathing is when individuals don't get enough oxygen when they're sleeping. Typically it happens with either there's hypopnea, which is insufficient or inefficient breathing, kind of like a cough. Like there's some air getting through, but it's not enough. And there's also apnea, which is the complete absence of breathing, complete absence of oxygen, and that's choking. That's the air is cut off, nothing's happening. So in obstructive sleep apnea, there are actually soft tissues, which could be the tonsils, adenoids, the dangle-down uvula. That can get puffy if there's congestion or if there's snoring that creates turbulent breathing, and that actually causes more inflammation of the uvula. Also, the tongue itself can fall back into the throat. And people who have large neck circumference, whether it's people who are overweight or very muscular athletes, when you lie down, particularly on your back, all the muscles in the soft tissues collapse, cut off the oxygen flow. So untreated sleep apnea causes a whole host of serious medical conditions. High blood pressure, risk of heart disease and stroke, risk of Alzheimer's, reflux, diabetes, depression, and erectile dysfunction, just to add insult to injury.
No two patients are the same. That's why Dr. Garceau creates customized treatment plans. We learn about some of the options she offers.
Sleep apnea can be diagnosed through an overnight test. Basically, you go to a lab and get hooked up to a bunch of monitors, and you sleep there for the night. More commonly now, home sleep tests are available, which is a lot less invasive. You basically take a fanny pack or a little visor, wear it while you're sleeping, and bring it back to be downloaded the next day. In my practice, we use a pharyngometer, which actually it's a non-invasive way to measure a person's breathing, to find that sweet spot in your throat. So we don't want you overstretched or scrunched down, but really to know at what setting can you best breathe. So the traditional treatment options include mask therapy, which basically you wear some form of mask on your face at night, you're plugged into the wall, and it forces oxygen into your body. There's different kinds of surgeries for children that might be removing the tonsils and adenoids. There are also other surgeries that can be a little barbaric and have mixed results. So another option that I can fill is oral appliance therapy. And the most common is a mandibular advancement splint, which helps to posture the jaw forward and the tongue with it, so it helps to prevent your tongue from falling back in your throat and choking you. Oral appliance, as opposed to a traditional mask therapy, benefits are, it doesn't rely on electricity at all. So it can be taken when traveling, camping, people who fly a lot don't want to schlep the whole oxygen thing through the TSA, as well as you can even wear it on the airplane. Some folks are afraid to fall asleep because they're going to start snoring. So it's not healthy and it's embarrassing. Other advantages are it's non-invasive and compliance is really great.
Well, this past year, I really am a different person. I'm more alert at work. I don't need coffee to try and keep me awake. I have a pattern now where I go to sleep. I make sure I wear my mouthpiece. And just from me and everybody else, a totally different person.
Dr. Roberta Garceau and her dental team truly care about your smile, your sleep, and your health, creating healthier smiles and a healthier life.